Welcome to the special edition of the latest printed press. I'm Aysen Djemal, and tonight we have got the latest COVID update for our guests out there. And I'm very happy to have some experts on our guest panel tonight. We have Dr. Mekella Yesil, who is the public health researcher and Haringey vaccine ambassador. Welcome, as always, to the program. It's nice to see you, Mekella.
You too, Aysen. Nice to be on your show again. Thank you for having me.
Thank you very much for coming on. We also have Sibel Ihsan, who is the lead Directorate Pharmacist in Waltham Forest Borough. Welcome, Sibel, to our program tonight.
Hello, thank you very much for having me. Nice to meet you all.
Oh, it's very nice to meet you, and you're very welcome. Thank you very much for coming on the program. And as always, we have Dr. Fulya Yahioglu, who is the Senior Public Health Commissioner. Welcome, Fulya, to my program once again. Thank you very much for coming.
Welcome. It feels a bit like deja vu.
It does, doesn't it? It does. We're back here again. And of course, we have Erim, Metto, CEO of the TCCA, also joining us tonight. Welcome, Erim, to the program.
Thank you. Nice to see you all again.
Yes, it's all good to be here again. I mean, obviously, there's been lots of different updates and changes to the COVID-19 situation. So I'm going to jump right into it and ask Fulya to tell us what's happened with this new variant and why has it caused such an issue for our community?
Okay. Well, I mean, it does feel a bit like deja vu from last year, but this new variant, which was first detected in South Africa and was deemed a variant of concern by the World Health Authority organization on the 26th of November. I mean, it's kind of escalated quite fast. I mean, we're the 23rd of December, and already we've got 119,789 confirmed daily cases of Omicron, which is the new variant. That's compared to last year of 68,000 last winter. So you can see how much of a change that we've had in the confirmed cases, positive cases. So the Omicron, it looks like it's been spreading literally to about 89 countries at the moment. And as you've heard, we have seen that lots of countries have put in measures to kind of mitigate the infections that are arising from Omicron. I mean, the Omicron poses quite a threat purely because we've seen that it has twice as much mutations as the previous Delta variant. So we've got about around 50 mutations. Around 30 of these are on the spike. And one of the problems of having mutations on the spike is that it allows the virus to have the ability to bind to human cells and initiate an infection, causing more transmissibility, and also, as we have seen, to evade the immune response. So we know London is the epicenter at the moment of this Omicron variant, but we're also aware that the Delta is still in circulation, even though Omicron is the main variant. There is a much higher transmission rate of Omicron, and people who've so far avoided the disease are at much higher risk of infection than before. It can cause breakthrough infections, even in vaccinated people, and reinfections in people who've had the virus before, even if it's very mild. And at the moment, we've seen from Imperial College studies that the kind of severity of the disease is low. So we're not getting as much hospital admissions as previously. But that doesn't mean that people won't be getting infected, because the risk of getting an infection is 3 times higher with this variant and reinfection than other variants. And because it is more transmissible, it causes a severe threat to healthcare systems, even though it's a milder strain. We have pressure on the NHS and in hospitals. We've got people that have been kind of testing positive. I mean, you've seen the cases. Everybody that I know has had a positive test somewhere along the line. I haven't seen them, but I mean, I've been told they're isolating. So lots of people are isolating. And even though we've reduced the isolation period down to 7 days, that still causes a lot of problem in the community. in terms of hospital, in terms of the NHS, in terms of kind of GPs, etc., and even in terms of vaccination, because staff may be off sick due to the virus. So the other thing is that we're aware of is that Delta is still circulating, and you've got Omicron. So there are people who could be co-infected with Delta and Omicron. So that causes a particular threat for those with low immunity. Plus, we don't have much data around Omicron and the BAME communities. We know that the BAME communities, the Black and ethnic minority communities, especially the Turkish Cypriot community, we've been all disproportionately affected with increasing deaths from COVID. I mean, last year, we knew a whole host of people who've died, unfortunately, from COVID-19. So we need to kind of be very, very careful about that, because we know that our population has got kind of long-term health conditions. We've got lots of people who are older. So we have to be really, really mindful, especially as it's Christmas and we know there's a lot of intergenerational mixing. So I think we just have to be really, really careful, because we know that young people is circulating within young people. So young people, below 40. And then we don't know the impact it's going to have on older people, even those who've been vaccinated. We know you can get reinfected. We know that the boosters help, and they cause a less severe kind of impact. So you'll get mild kind of cold-like symptoms like a runny nose, high temperature, fatigue, kind of general cold symptoms. But the problem is Omicron may be less risky for each of us, but more risky for all of us. So it really is a balancing act. So we've got much more transmissible variant out there, and it's causing lots and lots of problems at the moment, even though the severity is much lower.
Yes, so we have to be that extra cautious. I think you made a very good point with the fact that we're going to be mixing generations. So that's one to be aware of as well. And we're going to be talking about boosters and vaccinations relating to this a bit later on. But Meg, just to get some statistics from yourself, what are the current case numbers in relation to hospitalization, illness, and how does this change? And how do we compare this to the rest of the world? Like, what sort of position are we at in the UK?
Well, at the moment, obviously, you know that the European Union have obviously shut the borders to the UK, so we're not allowed to travel to certain parts of the country. And obviously, if you do travel, you have to do PCR tests, make sure you've got your vaccination certificate and everything before you are fit to fly. But obviously, the situation now is we've administered in this country alone 130 million doses. 47.2 million people have been fully vaccinated, and that equates to 70.2% of the population. So from a medical perspective, we are doing really well, and we're actually ninth out of 202 countries. We actually come ninth in relation to other countries like America, Australia, Spain, Norway, France. So we've got a higher vaccination rate than most people. The infections may be high, but our death rates are much, much lower than last year, this time last year. So on a positive note, I can say that 11 million boosters have been delivered in the UK to this day. I've actually got the figures on my laptop today, and 23 million boosters were delivered up to today's date, which means that we've got I believe it's let's have a look, 23 million boosters at today's date. 57% of the population have had their third vaccine, which is really, really good. So that's a positive note. We just have to encourage people to take up the third vaccine if they can, and if they're willing to do so.
Yes, because I know from my own sort of close community that people have been resisting that third vaccination, or booster, should I call it, because people are, they don't look forward to being ill for a day. I just had it. I had it 2 days ago, and yes, for about half a day, I did feel quite worse for wear. It gave me a bit of a headache and a sore arm, but I'm fine now, and I feel much safer and content.
So you're living proof that the vaccines do work, and they only last for a few hours, or 24 hours the most. Some people will get an immune response, which is normal. So you will feel slightly fatigued, you'll have a fever, you might feel like you're catching a cold, which you won't. But any other issues in relation to your heart or anything else, or any other side effects, you can report them on the yellow card as before anyway. Obviously, if there is a significant change in normalities to how your health is normally, then obviously you can contact 111 or A&E or whatever reason, but there shouldn't be. There is no situation, there's no reason why you shouldn't get vaccinated.
Definitely. Right, I'm going to go on to Sibel now, and we're going to talk about vaccinations. I said to give you protection from the virus. However, there is a bit of a confusion with this in relation to how much protection there is when it comes to the Omicron strand, and why is it so essential for us to have a booster, providing us with that extra level of protection. Can you, I mean, obviously we touched upon it with Met just now, but if you could just elaborate for us and for our
of course.
viewers.
Yeah, so first of all, just to say that there is a lot of information out there at the moment, and sometimes it's really, really difficult to know what sources to trust and what's accurate and what's not. But the booster, it really helps to improve the protection if you have had your first 2 doses. And basically, it just gives you that long-term protection against getting seriously ill from COVID. There have been sort of numerous studies that are out, so from Pfizer and both from Pfizer and from Moderna, and they found that basically 3 doses of the vaccine offers a really strong antibody response to Omicron specifically, and it gives you multiple times more antibody protection than the standard 2 doses. So that's why we're advocating, go and get your boosters, and it's really important that everyone does go out and get it. And also, just to mention that the effectiveness of the vaccine when you actually have COVID symptoms is reduced against Omicron with just the 2 doses. But then when you have the 3rd dose, your protection is back up to that 70% mark. So that's really important to know. And I guess the science behind it is sort of when we get vaccinated, we have a memory sort of T cells that are created and are circulating in our bodies. And then if we then expose them to the antigen again, i.e. the virus, then this will result in them multiplying and then forming even more antibodies and more cells, and that's what actually gives us that additional protection. So definitely really important that everyone goes out and gets their boosters.
Okay, brilliant. We've got some questions coming in actually. So I'm just going to look at this very quickly. Bertan has said, hello, everybody. Metin Ali has said, hi, all. And then Direct Community Support has said, great support and information. They have said only for 10 weeks. So does this mean 4th job in 100 days with an Omicron specific job? I'm not quite sure what that question is there.
I think what they're asking is going to be a 4th jab.
Right. Oh, I see. Would there be a 4th one? Well, what's the answer to that? Is there an answer? Do we know?
There's consideration, but I don't think they're looking into it at the moment, because several other countries like Israel, who's been on the forefront, they're giving out the 4th jab, but there's nothing being confirmed in the UK at the moment around the 4th jab.
So not yet, maybe in the future, in 6 months' time, but not currently. I think it's probably.
I'm not sure it'd be Omicron specific, because I'm sure we give it a few more weeks, we'll see the changes, within the kind of what when it's going around in the community, and it'll be less severe. So
definitely. Good. Neil has put, I have tested positive but have no symptoms. Is this quite common?
Yes, it is common. It is common. I mean, normally you'd get a sniffly nose, or you'd get a headache or something like that, cold-like symptoms, and you'll put it down to, you've been out, we haven't been exposed to anything, particularly if you've been working from home. So yes, you won't get the same symptoms as the loss of taste or smell, which is quite common within the kind of COVID-19 previous variants. This is a slightly milder, so you might just even bypass it and not think about it.
Oh, that's good news then. That's not bad news.
No.
It's much better news, isn't it? We've got one more question and we're going to go on to Erim. Abby Hussein has put, please discuss the so much ill-informed anti-vax messages circulating.
Anti-vaxxers.
Turkish Facebook groups. People are being bullied if they are not anti-vaccine, yes. So much rubbish has been circulated by certain people. I'm surprised Facebook hasn't shut these groups down. Right, so Abby Hussein is quite, adamant with this. And I wanted to sort of, put this question up. Is anyone prepared to answer that? What do we think?
Who's responsible for Facebook, though? Is it down to us? I mean, we've tried to at the beginning. Last year we had so many conspiracy theories, didn't we, Fulya?
Yeah,
You
we did.
remember,
We did.
Aysen, the
Yeah.
questions we were getting, like, you know, are they going to change your DNA and stuff like that? It's ludicrous. Where do
No,
they get their information from?
I think the problem is people are scared. There's a lot of people out there who are scared. They're reading a lot of material on the web, as we've seen. You know, not everybody has the right information, and we need to get more kind of correct, verified information. And people read, and then they've got their alternative therapies, which is fine. I mean, we're not forcing anyone to have a vaccine, but I think what the ultimate aim is that if you do not get vaccinated, you are potentially kind of impacting on other people. You don't know who has low immunity. You may be transmitting the virus, not knowing about it. You may still be fine. But I think we just have to think about others. None of us want to keep taking vaccines, but I think it's about protecting other people and protecting yourself as well. And also, what I would say is, if we don't get a level of protection, and I hear what people are saying, you know, you want to travel, we're traveling, the virus goes around. We know that certain countries don't have the vaccination means. It's just going to circulate, and we're going to get various different variants around. And I think the only way that you're going to absolutely try and get this kind of COVID in line is if people do get vaccinated. I think it really is important that we all get vaccinated throughout the world. I mean, it's not just UK. I mean, shutting borders is great, but what happens when you open the borders? People are going to travel. Some will be vaccinated, some won't be vaccinated. So I think there's a much bigger picture out there.
For sure. It doesn't stop with us, you know, closing borders. I think we've gone beyond that. I think really, like you said, you've got to think about the long term and think like a community, really, and not just think about yourself, but everybody. You know, this is the only way we can go forward. Which leads me very nicely to Erim and the TCCA, who is working closely to encourage uptake of the vaccine. What are you doing? Can you tell us a bit around your team and its aim with regards to this, Erim?
Yeah, so as we all know, that TCCA reacted when the lockdown first happened in March last year. We even reacted before lockdown occurred, and it's always been our attempt to try to work towards the changing needs of the community as the climate changes. Now, one of the things we completed, obviously, was that we organised a number of debates on various debate channels that considered both sides and considered why people consider vaccination not appropriate and why they consider it unsafe. As Fulya has stated, that it is up to individuals if they want to get vaccinated, but they should have all the information at hand. And as a society, we need to ensure, where possible, we protect our complete community and not just focus on allowing individuals to be able to push forward mass propaganda against vaccination that then takes away the individual's choice to have vaccination. What we've also completed is, when vaccination first occurred, we did the first Turkish vaccination pop-up at TCCA. We've also, from then, we've done another 7 vaccination pop-ups, and we've also worked with a number of vaccination clinics to ensure that our community has access to these clinics. And that means if people can't, because of transport needs, we will try to help. If there is language difficulties and want further information to be provided when they do attend the vaccination clinic, then we provide that. If there is concerns about certain issues to do with the vaccination, we find out. For example, there was a lot of concern in relationship to having a dose of the second vaccine when you had the first dose of the vaccine that was being used in Cyprus, for example. So they're the kind of things that we're doing. We now have a vaccination team made up of 4 officers within the TCCA. Each one of those has a different speciality that look at dealing with different areas and different concerns. Some of it's based on information, some of it's based on considering setting up these vaccination pop-ups. What we also have as a community is we have a number of vaccination sessions that we have planned in the future. And if Turkish speakers want to attend any of those vaccination pop-ups, then we have the ability to make sure that they are available to them and they have the aftercare, because sometimes we forget that sometimes that there are issues within our community around if there is an individual which has a bad response to the vaccine, they're not sure where to turn to, and us as an organisation want to act as the intermediary to be able to help provide accurate information to those individuals. This program is one of the examples of the ways we're dealing with the vaccine, is that we're updating. There's lots of concerns around how Omicron is prevailing in our community, and how the vaccination will help us alleviate the Omicron variant for our community. So it's in essence that there are a number of things set up that are here, and if there's more things that are needed, we will provide it. We will ensure we get funding for it, and if we don't get funding, it will come from the core staff that we have within TCCA. So that's where we're at. And for me, I'm extremely grateful that we have these individuals in our community, like Meg, like Sibel, like yourself, Aysen, as well, and like Fulya, that are there to provide the platform for our community to be able to engage in and to be able to receive accurate information on the vaccine, and also how it deals with these new variants that are in our community.
Yes, I mean, it's very important. And thank you very much to yourself and the TCCA and all the work that you do. I don't think as a community we would be where we're at currently if it wasn't for, your community group and lots of other community groups, of course, out there supporting the community. And I think we really did pull together during those sort of initial times of COVID-19 and the lockdowns. And I'm sure we will move forward. And yes, there is propaganda and all sorts of things that do fly around social media. But like Fulya and Mekella did just state now, I think it's a personal choice. I think you need to just, take what you think is a reliable source. And, like Erim was saying, look at information with the TCCA, with the programs that we deliver as You're Against TV, and then make your decisions, because obviously we've got the experts here who have the experience and knowledge. So I really would take heed and say this to the community to watch over this program. Even if you can't see it live, please have a listen, because this is where, the actual factual information lies. And I'm very thankful for yourselves for coming on and creating such an amazing panel. I mean, Fulya, this is a little bit of prediction. We were laughing about this before the program, so you're going to be a bit of a predictor here. So obviously we can't give an exact answer to this, but from your scientific professional opinion, what do you think about more variants? Because I think people are fearful of this now. And is this variant, the Omicron, is it more potent? And will we ever see an end to this variant? Will there be other variants? What's your opinion on this?
I think with the case of Omicron, it's not, it doesn't cause severe disease from all the kind of information that we're getting at the moment. So it's not leading to hospitalizations per se, although we are seeing an increasing number of positive cases. So people are going through a lot milder, particularly as a percentage of the population is now vaccinated. So that will help in that sense. In terms of it dying down, we're seeing that in South Africa, where it originated, it's starting to plateau the cases, and they're not seeing any kind of significant deaths or kind of major increases in hospital and severe disease. So that's a good kind of indicator for us. So we're behind probably about 2 or 3 weeks from them. So I can't predict what will happen, but I think the Omicron, we're hoping it will become more endemic. So a bit like a cold. It will kind of come and go, and then hopefully with all the people that are being vaccinated, it will actually have nowhere to go, and it will die down in the new year, January, perhaps a bit longer, but eventually it will. It's not, as I say, it's not causing severe disease at the moment, but what it is doing is it is putting an increased amount of pressure on the NHS in terms of the number of people who are picking up the virus because of its transmissibility. And it only takes a very short incubation period. I mean, it's like up to 3 days, whereas normally it would be about 7 to 10 days incubation period. So people are catching it a lot quicker. And I think we just have to be really, really careful around it. So things like mask wearing, social distancing, washing hands regularly. I mean, we need to get back to doing all that. Cleaning surfaces, absolutely. I think we need to do that. Ventilation in houses, doing your lateral flow tests, trying to minimize some of the mixing that's going on if possible. I think those are the things that will help. In terms of other kind of variants, as we know, the COVID virus, or the SARS-CoV-2 virus, it's very susceptible. It kind of multiplies. It's a protein mRNA, and then you've got a lipid layer, so a fatty layer, and that's it. And then you've got the spike proteins, which latch on to your ACE cells within your lungs, etc. And that's how it kind of gets in, and it goes into your system. So because it replicates and it needs a host, I mean, the virus cannot survive without a host, and the host is us, unfortunately. It's a parasite. So basically, it multiplies and multiplies and gets into your system. Now, if you're multiplying something by 1,000, 10,000 times, it's going to start to, you will get mutations. You know, you might get one letter mutating, you might get two, but out of 10,000 or 100,000 replications, you'll get a lot more mutations. So some of these mutations may be harmful. Some of those may make the virus more transmissible, like we've got with the Omicron. Yeah. And we might get more variants of concern, but I think we just don't know at the moment where it's going to go. But I think what we're seeing is that we are, with this particular Omicron, it is less severe. And I think we are kind of moving towards kind of, maybe even if viruses are mutating, hopefully we won't get such a degree of kind of hospitalization and death as we did in the first round last year. It's still going to be around when we've got borders that are going to be opened up in the new year. Hopefully kind of people are going to be traveling. Unless we vaccinate a proportion of the world, it is going to be difficult not to have mutations. And as we know, some of those countries, third world countries, their vaccination rates are poor due to the fact that they can't get hold of vaccines. And that makes it very, very difficult, because people will travel. You will go to countries. You'll be working in other countries. We'll be passing on the virus. There will be mutations. There'll be people who are unvaccinated, even in this country. There'll be some who were absolutely adamant they don't want the vaccination, which is fine, because as we said, no one is forced to take it. But I think we have to look at the bigger picture, which is that we are trying to make this particular virus endemic. And the only way you're going to make it endemic is if you vaccinate a high proportion of the population and the world.
For sure. I mean, it moves me very quickly to Mek's question. We've got lots and lots of questions as well from the audiences, so I'm aware of that. So I'm going to take Mek's question, and then I'm going to answer all the questions there, not to worry, from our public. Mek, for those either who decide not to take the vaccine and what added protection, what can they do? You know, for people who choose, no, I don't want to take the vaccine, what could they do?
Well, I would question as to why they wouldn't want to have the vaccine in the first place, and if they had any underlying issues, because obviously if they have a clinical reason, they should be vaccinated, especially if they're immune compromised. That would be even more reason to get them vaccinated. And obviously it depends on their gender, their vulnerability, their age. Those are things we have to question as to why they wouldn't want the vaccine. Sometimes it could be that they're just scared because they're worried about what they've been hearing on social media, like some of the comments that people are making. So I would want to sit down and talk with them on a face-to-face or somehow, and sort of change their mind. But obviously, like Fulya mentioned, cleanliness, hand washing, gels, masking, social distancing, again with ventilation, that's quite imperative. And like Fulya said, like, you know, this virus isn't going to end unless we do something about it. So it's down to each and every one of us to take responsibility. And obviously with Christmas just around the corner, people are going to be mixing, and some people are going to be more susceptible than others, because we don't know that how vulnerable other people are with their immune response. I mean, I know people who've had 3 jabs and still caught COVID, you know, but maybe not so severe. But you imagine somebody who hasn't had any of the jabs and catches COVID now, especially with like 3 variants, because you are able to catch Alpha, Delta and Omicron all at the same time. So if you have that, you're going to be very, very ill. And trust me, you do not want to go back to seeing hospital wards this time last year. I mean, get vaccinated and get protected. That is our only way forward. That's all I can say.
Yes. We've got a few questions with regards to Christmas. I'll very quickly pass by Aisha Ismail's comment. She's put, good evening, everyone. Thank you for continually educating, updating our community. You're all so valuable with your fountain of knowledge. Thank you very much. We've had a few others, Nalan, we've had Aisha and B Cash as well, all saying good evening. Aisha's saying another useful broadcast. Thank you. But I'm going to go on to Abby Hussein's question again and Gulnil, because I think both of them have got very good questions. Abby Hussein is, but I've invited friends, son and his girlfriend, who are both uni students, for Christmas lunch, which is lovely. She tested positive a week ago, the 16th. Will it be safe for her to visit, as there will be 10 of us around the table? No.
I'm going to say no. I'm saying no. Fulya can make her own mind up.
I think. I think.
Fulya now.
No. I think I would have said that's a 7-day. If she's isolated and she's done lateral flow tests and she's done a PCR and the PCR is negative, then yes. But I would be incredibly cautious at the moment. I think particularly with the younger student population, where it tends to it's more asymptomatic. But I think PCR tests would need to be done. I think a lateral flow test. Has a lateral flow test been done? I mean, I don't know if she can. Abby can respond back.
Respond back and say. Well, yeah, maybe he can. Gunil has put, how accurate are lateral flow tests? Some people have reported that they test negative and a couple of hours, a faint line appears indicating a positive result. How do we rule out false positive?
Well, the sensitivity around lateral flow is not as high as PCR tests, that's for sure, but they're still pretty accurate. I think the issue we've got is that how people actually use I suppose, what would you call it, the stick to kind of get all the sample. It's about sampling, and sometimes it is purely around how you do things. And you can get a positive later on. I mean, the incubation period for this is between 1 to 3 days, so you can get quite a quick turnaround in the results. But I think lateral flow are pretty accurate. I mean, PCR, you'd need confirmation, but I think you would need to look at the instruction and try and do it properly. We all think we can do it properly, but I think maybe we need to just reinvestigate.
Yeah, definitely.
Somebody else to do it for you.
Oh, somebody else.
Yeah. We get confused. Lots of times we've gotten confused when my children had to do it for school and stuff, and we've had to redo it because sometimes it can get confusing. I think with something like that, if you're not 100% sure, then do it again and maybe get a second opinion. Like you said, get someone else to do it for you. That's how we've done it. We've done it all together, like a few of us. So just make sure. And maybe normally when they give you the packet, especially if you've got kids that go to school, there's quite a few in the actual packet. So try a few times if you're a bit unsure. Try a few times. And obviously I have to regularly anyway, once a week, at least minimum, probably 3 times a week, because obviously I work in schools. So, I mean, I do it all the time anyway. And I think it's quite accurate. I think it's pretty accurate.
Yeah, I think it is. As I said, PCR is the most accurate form because of the sensitivity. But lateral flows are good at detecting the virus. Yeah.
Yeah, B Cassius, but how does Omicron differ from other strains in its effects on the human body? Dear Dr. Mekella, it's been direct.
He's one of the scientists that work with me, and he's from Bangladesh. So it's probably 6 hours ahead of us. So he's probably stayed up to watch the program. Different from strains and its effects on the human body. Well, it doesn't affect the lungs so much. It affects the upper respiratory tract, we know. So it's more sore throat and cough, and obviously you get the mucus. It doesn't affect the lungs, which is one of the good things. It doesn't affect, the need to sort of like be ventilated or have oxygen, which is one of the good things. So that's why it's not so contagious. Well, it's contagious, but it's not so fatal, shall we say?
Right, and Nalan Beddings put, thank you so much, all of you. And Abby Hussein has put, no, it will be done tomorrow.
That's her test.
Okay. Well then, what to tomorrow 24? Still cutting it fine.
8 days. I wouldn't risk it. I would wait for the 10th day. or
Yeah,
get protected, just to be on the safe side, because you could still be shedding the virus. We don't
Yeah.
know. We don't know your
Absolutely.
incubation
No.
period.
I think if you've got,
Unfortunately, yeah.
I think
But
if there's 10 people around the table, I think, better to err on the side of caution.
Yes,
just
most
in
definitely.
case.
just in case, I think so as well. Err on the side of caution. I know it's sad, isn't it? It's sad that sometimes we can't all get together, but I think, for the long term, don't risk it is our advice. Abby Hussein, unfortunately, sorry. She'll have to video Skype you or something. So she'll be there through the internet. That's how we've had to do things sometimes. Sibel, if someone wanted to book a booster, how easy can it be done? And will there be a second booster? If so, when?
Yeah, so it's actually really easy to get your booster. There's a few ways that you can go about this. So you can book online for an appointment at a vaccination centre or at a local pharmacy, or you could go to a walk-in vaccination site to get vaccinating, and that way you won't actually need an appointment. There is a link on the NHS website, so you can always find out which site is more like the most local to you through that. And just bear in mind, though, because working on a vaccination site myself, sometimes there are issues with stock availability. So although it might be advertised as a walk-in centre, you might be told on the day that they don't have enough vaccines. So maybe just give them a call before you actually go past or you sort of like you go to the site. There are also other ways, so you can wait to be contacted by your GP and then they can book you in for an appointment. There are some housebound patients which actually they can't get to a vaccination site or can't go to a walk-in centre. Those patients are usually contacted by their GP and then the GP sends out sort of a nurse, they call it sort of a roving team, and they go around to the patient's home and then you can get vaccinated that way. If you work for the NHS or if you work in a care home, you should be able to get your booster through your employer, or you could go to any vaccination site, show them your ID card, and then you should be able to get it that way as well. So there's lots of different ways that you can get it. With the booster dose, if you've had your second dose, so if you've had the first and the second, then you have to wait approximately 3 months before you can get your booster. And anyone over the age of 18 is eligible. If you're 16 or over with a health condition that puts you at a slightly higher risk from getting serious disease, you can get it. Or like I mentioned, if you're a frontline worker or a care worker or a social worker, you can get it that way as well. There's most people would be able to get a booster. Also, just to mention that if you have a weakened immune system and you have had your third dose of the vaccine, you can get the booster dose as well, but you just have to wait 3 months after your third dose, and you can get a letter from your GP or a hospital. You can actually show that to a vaccination site, and then they will be able to book you in as well. So I mean, a lot of people are, they worry about what vaccine they're going to get, so they don't know whether it will be different to the first and the second dose. But usually it will either be, so the boosters will either be the Pfizer or the Moderna vaccine. So it might be different to the vaccine that you had for the first and second, but just bear in mind that those two have shown the most sort of effectiveness, so it will most likely be those two. There are exceptions. So if you, for example, if you've had like an allergic reaction to one of the ingredients in the Pfizer vaccine, and you had the AstraZeneca as your first and second, then as an exception, they may give you the AstraZeneca as well. But just expect to either get the Moderna or the Pfizer vaccine.
Yes.
Which is really important. And also to mention as well, if you have had COVID symptoms and if you are COVID positive, then you have to wait at least 28 days before you can actually have your booster. So it's best not to go to a vaccination site if you have tested positive.
Oh, okay. So that's one to think about. But
Mhm.
they ask you
Yeah.
anyway when you go in. They do say,
Yeah, they
have
do.
you
Yeah, they're
for it?
quite
They
good
do
like that.
ask.
Yeah,
Yeah, they are quite good.
yeah,
We've had lots
yeah,
and lots of questions coming in.
yeah.
Fevzi has written, Fevzi Hussein has written, Salam lad everybody. Great to see this program. I have to say I'm rather fatigued by everything COVID related and genuinely feel our civil liberties are being attacked. This said, I have been compliant as I have clinically extremely vulnerable members very close to me, and the last thing I want to do is subject them to any further risk. I mean, people of course are, I mean, people can relate to that. People are feeling that, especially in this season, you know, when we have to tell people that they can't see their loved ones. But generally, as scientists, specialists, doctors, what would you advise for people feeling that mentally? What would you say to them? Anybody? Big question.
Have a
Should we
drink. Have some mulled wine.
if people are trying to sort of like want to meet up and they've all been having their vaccines, like their second or their third boosters, then I would say do like a PCR test before you join them, or take precautions like have the rooms ventilated if you are going to meet. But obviously, if you've got young children, like when I say young, like 12, 13, 14-year-olds, make sure you get tested before you meet your family members. I mean, those liberties, they're not arbitrary what they're doing at the moment, but obviously they're mandatory to the extent that we're taking the responsibility as to whether or not we want to meet family members at Christmas time. So I think it's on our, like I said, it's down to our own personal responsibility to take the risk or not. Everyone can decide their own if they want to meet family or not.
Yeah, I just want to say a few words on personal liberties and so forth. Is that I do feel that when we're looking at science and when we're looking at the factors that influence us as a complete community, then I think when it comes down to the aspects around how much we are allowed to integrate with each other and what rules are put in place, I think that's valid. I think when it's deemed to be political and it's politically motivated, then I think that's an issue. And I think that when we talk about vaccinations, I don't think it should be mandatory. I think mandatory goes beyond the line of acceptability. I think people need to be informed by accurate science around the vaccine and what the vaccine, how the vaccine protects you, and be based on facts rather than being based on fiction. I think our final note from myself before I pass back to my colleagues is that I do feel that when we talk about the aspect of how we move forward in response to COVID and why we have these programs, is that because our community has wanted to understand certain issues, because there has been a lot of change in the last 3 weeks, and that's why we have started to relaunch these programs, because people don't understand what the Omicron is in connection with what Delta was, how it affects you. There's lots of information which is changing daily, and to filter through that information and be able to get core accurate information through to our community, then I think that's important for us to be able to take on that mantle and be able to provide that information.
Yeah, for sure.
Mm.
Definitely. I mean, my next question actually, Erim, was going to be, it'd be nice for us to find out what services the TCCA is delivering just generally during these difficult winter months.
Yeah, I mean, we like the vaccine. So we have a total of 28 projects that operate within our community that we provide. I mean, our largest is home care, and there are real unsung heroes, because we have a total of 55 carers that work for TCCA. Those 55 carers going day out to provide care for the most vulnerable in our community, and their safety is at risk each time they walk through that door, and each time they provide care to that individual. So they are unsung heroes, and we don't mention them enough. And I'm going to do a program about them in the future. Outside that, we have a number of other projects which are continuing all the way through, all the way from room bookings that we use to book hire out space for our community, right the way through to our COVID project, which we set up when COVID first struck. And that has a number of strands. And one of those is the vaccine strand. The others is food runs, and we will consider relaunching our food runs if we get to a position where vulnerable are left isolated at home. We have other aspects of what we are doing, which is that we provide an information point for people to come and ask us any questions that they want in relationship to COVID. There's a lot of associated issues which have come about because of COVID, and things like mental health, and we're trying to deliver very, very soon a quite substantive mental health project which will serve all our community, but serve it in such a way that the consideration is given to the different elements of our community, i.e. the young will have different issues to someone who suffered a bereavement due to COVID. So we respect that the community has different facets within it, but we know that as a community that we have suffered due to mental health quite substantively. We're also looking for a new officer who will be dealing with our health and well-being within our community, because we know obviously that the more healthy we are and the more well we are, the easier it is to deal with if we do register positive with COVID. And it also creates a greater awareness of how what we eat, what we exercise, will kind of help us to keep out the hospital system. So that's something that we receive funding for, and we're going to be launching that very, very soon. We also have a number of other projects that we're working with partners like helping the homeless and other things. And there's a number of organisations that we continually partner with, and groups like Chutter, groups like Cubers Worldwide, TCCA UK, Edible London, Cyprus. There's a myriad of organisations that we work with, because we understand that the fact that although we have a strong skill set in a certain area, that there's other skill sets that other organisations have that we don't necessarily have, that when we do partner, that those skill sets become far more integral to supporting a substantive and a good, well-delivered project. So, and we're here to listen to what you as a community, our community, wants us to do and what the needs are within the community. So once those issues become apparent to us, then we will do everything in our power to make sure those projects that we need are delivered.
Brilliant, fantastic. We've got a few more questions, and we're sort of coming to the end of our program. Abi Hussein's put, yesterday Israel announced they might go forth with a fourth booster. We talked about this, and is it likely UK will introduce? Well, we spoke about that earlier, and we said at the moment we're not sure. It may happen, it may not. Also, a third dose or booster that is needed. I'm not quite sure. Is that the question?
Yeah.
Oh,
Yeah.
She will need a third dose. Yes, she will.
Yes. Yeah.
Yeah, she will need her third dose.
100%.
Yeah.
No
But I
doubt.
think you would have to contact your GP, Selen, because they should be sending out letters if you are eligible. And if you haven't received anything, then it's probably best to contact them to find out.
Okay. Fevzi Hussein has also said family members in Cyprus have had a second booster jab. Doesn't 4 jabs in a 12 to 15 month period sound excessive?
Not really.
No.
Not really. Because don't forget, your blood cells deplete after 120 days. So every 120 days, you get a new set of blood cells. Unless you know the biology behind it, it's very difficult to explain to people. Fulya will agree with me, and I'm sure Sibel will as well. The vaccines don't stay in our bodies for very long. They deplete. So every 120 days, you get a new lot of blood cells. So you don't repeatedly transform those T cells, as Sibel mentioned earlier. So sometimes we do have to top them up, which is why we have the flu vaccines every year.
Yeah,
I mean, the only sorry, Sibel, the only thing I was going to say was that in Cyprus, the vaccines that were given were the Sinovac, and I believe that in terms of its effectiveness, it probably wasn't as effective as the Pfizer and the Moderna. So that could be why there's more kind of boosters coming up to try and protect people in Cyprus, because they are a small island and they're very susceptible. And we've had a lot of people coming over from England going over there. And I'm not sure all of them were vaccinated. I mean, you could fly in with a negative PCR test. So I think it is a bit of a problem. Sibel, go ahead. Sorry, darling.
Yeah, no, that's okay. No, I was just going to say that, with regards to sort of like subsequent boosters, we will probably, scientists are already beginning to sort of combine the influenza vaccine with the COVID vaccine. So there's already work that's began. And actually, maybe our annual sort of flu jabs will be a combination of both flu and COVID. So as you know, as Melika mentioned, like the immunity, it does sort of start to wane off after the 6-month period, and that's when, you know, our hospital admissions will go up if you don't have that, you know, sufficient immunity within you. So no, it's really important that, you know, we don't know whether there's going to be a second booster or how frequently it's going to be. I mean, it's to be confirmed at the moment. We haven't had any sort of direction with that, but we do suspect that it will probably be a lot like our flu jabs, our annual flu jabs.
Okay, brilliant. We've got a few more questions here, and I think we're going to have to wrap it to the end of the program now. But Gloria's put something about available data on Madeira COVID-19 vaccine administered to pregnant women are insufficient to inform vaccine associated risks in pregnancy. Our findings show a positive connection between the number of vaccines doses administered and the percentage of hospitalizations and deaths. This is all taken from somewhere, I think.
But that's inconclusive, and I think it's incorrect. I think it's probably an anti-vaxxer.
Yeah.
Okay.
Yeah.
And there's more.
Yeah.
There's more. I mean, we'll put it up just so that they can have their say. Recorded vaccine on 12 weeks and 4 days pregnant. Normal ultrasound 4 days prior was normal too. The baby did not have a heartbeat.
That could be an
I mean,
underlying issue.
Yeah.
Maybe nothing to do with the vaccine
Vaccine.
whatsoever. No way.
Okay.
No. I mean, if
Just so
anything,
that we can say that they had their say. That's why I'm, you know, this program is a neutral program where we're giving off the facts. If anyone wants to give any information, then they can. But obviously, we've got the scientific experts here, qualified doctors of many, many years. So I think really your opinions are far more factual than things taken off the internet, to be honest with you. But thank you very much for the panel for coming onto my program. And for those of you who've watched and asked questions, thank you very much to our viewers. And this will be on our site as well, so people can rewatch it. But thank you from all of us. That's it from Eurogench TV. Have a good evening. Good night.